are we seeing less people in the foster system than what it looked like 10 years ago, or are we actually seeing still an increase?
Still an increase,
Wow.
unfortunately. Yeah, we're seeing intergenerational trauma, and our families are so separated now, right? We tend to be, one family's here, another family maybe in another city or another state, and people are a little bit more isolated. And I think so we got to bring our communities back together and support each other and value families and not judge them, but support them in their time of need.
Most people see foster care and mental health as broken systems, huge, messy, and impossible to actually fix. But today's guest, she's literally engineering change in space. Renee Brown, the CEO of DePaul, has a background not just in social work, but also in engineering. Two fields you would even think that actually go together. But that's exactly what's making her a powerhouse and transforming the foster care system, mental health service, as well as disability support. Miss Renee Brown, how are you doing today?
I'm doing good. How are you?
Good, good. How does someone even go from the engineering to the social work, and how do you even connect those dots? Like, how do you make it happen?
Sure. So I don't have an education in engineering. My dad was an engineer. So I was raised by an engineer, and my mom had her master's in social work. So my background living with two people with those two areas of expertise and being raised by them, it really helped me see the value of both of those worlds. And as I developed in my career, it came together. It came together like the desire to solve problems, which I saw my dad doing a lot of, and he was in the military and just organized and, that kind of thing. And then my mom with her compassion to help people and to help people have better lives. Those two things that just kind of naturally came together in me, and I'm grateful to be able to do it.
And I know you have a personal tie to the work when it comes to adoption. Your brother was adopted when you were young. What did that experience actually teach you about family systems and those gaps that exist in the foster care world?
Yeah, so I was 7 when we adopted my little brother, and obviously had no idea that families were made that way. But it did teach me that sometimes somebody else has to help a child when their parents are unable to raise them. So it taught me that families are formed in a lot of different ways. It also taught me that you don't have to be related biologically to someone to love them just as much.
True.
And watching him grow up, I saw there were moments, though, that he struggled with who he was, where he came from, and needing to explore that. So yes, it's great when there's families that are able to do that. But for the person who is adopted, there is still sometimes struggles in their lives of figuring out who they are when they don't have those connections.
I agree. And you stated that you were a therapist. Is that correct? Is what where you're supposed to?
Yeah.
So
I have my master's in clinical child psychology, and I'm a licensed professional counselor and a certified substance abuse counselor.
love it. So since you're a therapist, but you realize you could make a bigger impact by moving into that leadership perspective, which is where you're at today. What was that moment like? Was there like a specific moment that made you say, oh, I need to step up and really change things at a higher level?
Yeah, so I was working at an organization as a case manager, and I was working with children with disabilities. So I'd gotten my degree in mental health, but then my first job, that first job when you go out in your career field, you got to be a little flexible. So this was the opportunity that was there. So it was a case manager position with individuals with a disability. And the organization did a restructuring, and they actually added this supervisory position, brand new position that needed the combination of working with children with mental health issues and working with children with disabilities. They were combining that. So between my experience and my education, I was competitive for the position, and thankfully I got it. And once I got that position, I realized, wow, now instead of helping this individual family try to figure out what's going on with them, I got to figure out programs and could reach all the families that all the therapists were serving. So it was that moment of, oh, bigger reach, more people. This is fun.
Yeah, I love it. I anytime, especially in the nonprofit space, it's always fun. It doesn't really seem like work. And I'm pretty sure you've experienced that, right? It just seems like you're just doing something that you truly love every day. I do want to kind of talk about a lot of people when they get into these spaces, especially C-suite executives, CEO roles, where they're starting businesses, they deal with imposter syndrome, right? Stepping into these leadership roles.
Yeah.
Did you ever have that moment? And if so, how did you manage through it?
I did. So the CEO that was in my position before me, she was my supervisor, and I actually had conversations with her, like, do I want to do this next step? And thankfully, she let me in on some of the things that the CEO experiences. Like, you don't work with a board unless you're the CEO. So I was like, I don't even know if that's something I would be good at, whether I'd enjoy that. She's like, well, come to some board meetings, get to know some. So thankfully, I had a mentor that
Good.
allowed me to have some sneak peeks into figuring out. But still, it's a big leap. It's like the whole organization, right?
Yeah.
You're responsible for all of these people and and their livelihood, and then the people we serve. So it is a blessing to lead what you love, but it also is a huge responsibility. So there were times where I was like, I don't know if I'm up for this. So you lean on the people that help you, lean on the people that have done it before, lean on the people that believe you. I have a great cheering section, and just to go back to them and say, and they're like, you can do it, and you're not alone.
It matters. Yeah,
Yeah,
it
and you
matters. You
hire
have to
great
have that team.
people. Surround yourself
Hire.
with very talented people, and I've been able to
Mhm.
do that.
I love it. And it goes to show your leadership. I think sometimes we're like natural born leaders and sometimes may not even know it,
Mhm.
right? And I'm pretty sure getting into that space, while you may have experienced that, maybe there was some nerves, you're knocking out of the park. And I want to ask, if someone was to say, hey, what does DePaul Center Resources actually do? How do you enter that in the simplest way possible?
Yeah, so DePaul Community Resources, our vision is opening doors to hope and belonging for those that we serve. So we serve children in foster care, families that are adopting, we provide mental health services, and we serve individuals with a disability. Hope is the idea, the belief that your tomorrow can be different than your today. So
Mhm.
we want everybody that we touch to have the belief that they have the agency to make their tomorrow different than today. So if you're in foster care, or if you're in one of our independent living apartments and you want something different for your tomorrow, we want to help make sure that we remove the barriers to make that happen. Belonging is that
Mhm.
everybody should have a community that they feel valued in, that they are contributing to, and that they are supported by. So that's what we do every day. Like, everybody should have a no matter what family, no matter what.
You just mentioned you're tackling really some major issues here in our country: foster care, mental health, disabilities. Any of these keep you up at night? I know normally people say, I have a work-life balance, but let's be honest, when you are doing this type of mission, this type of work, it just lives with you. This is what you do all day. Any of these keeping you up?
Absolutely. It all does. Because the statistics, right, are
Mhm.
tough. 1 in 4 young adults that age out of foster care end up homeless, right? There's 70% of young women who age out of foster care are pregnant before they're 21. We have
Mm.
over 350,000 children in foster care right now. So in our nation. So it's a big problem. And self-care is really important. And I practice that, and we preach that here at DePaul. You have to take care of yourself. We encourage staff to take 30 minutes of their work week every week on the clock to do some sort of self-care. They can clean out their car. They can, throw away the bad stuff that's in the refrigerator. They can meet a friend for coffee. They can write a letter. They can make a phone call. They can watch 30 minutes of a TV show to take their mind off of things. You really have to take those moments to take care of yourself, because you've
Yeah.
got to take care of yourself in order to take care of the children and the people with disabilities that we are here to serve.
I love that. I actually heard that from my wife so many years ago when we first got together, and I was telling the people, or just for the first time speaking out on sexual abuse and adoption and all these things that I encountered as a young adult. And I remember when it came to me wanting to do a nonprofit, and she said exactly what you said. How do you help someone if you haven't helped yourself?
Yeah.
So I love that you keep that, because I can only imagine you learned that so many years ago and you're still implementing it today, because it is so crucial, especially in the line of work that you do and hearing some of the stories. So I would actually even kind of pivot to that. What's that story for you that really sticks with you to this day and reminds you why you even do this every day?
Yeah, so there's a couple things. One thing is, so when DePaul started in 1977, we were a foster care agency. And we
Wow.
had one individual in our foster care system that was aging out who happened to have a disability, and there were not the services in our community to support them. So we
Hmm.
started our developmental disabilities division because of one person that didn't have what they needed in the community. I wasn't here working then, but that's the story that it's like, that's why you do it, right? It doesn't have to
Hmm.
be for masses. It just takes one person's needs. Let's meet that person's needs. And then, right, we scale it up and we continue to meet other people's needs. So
100%.
one person can make a difference in our work.
I do truly agree. Just that one impact that you make could change someone's life
Yeah.
forever. And not only that, that one person continue to change maybe somebody else's life.
Right.
What is that misconception when when we talk about healthcare, not healthcare, sorry, foster care?
Mm-hmm.
What's the biggest misconception people actually have about it?
Yeah, so a lot of people think that the foster parents are in it for the money,
Hmm.
and they do to get financially reimbursed for taking care of children. But if you met some of the children that are walking to their homes and the trauma that they have been through, you know that you have to have love to want to help a child at the worst moment of their lives, or one of the worst moments of their lives, when they're separated from everything they know, and to help them heal. So one of the misconceptions, though, is that foster care outcomes are better than if the child stays in their community. So we are trying to prevent children from coming into foster care because although it's a safety net, it's vital, it's important to keep children safe. But for long-term outcomes, we need to get children back to their communities as soon as we can to impact them long-term in a positive way.
Such stuff, man. Especially kind of experiencing that. I was adopted, and my brother was too. And I don't know what happened in life, but he ended up back in a group home for some years, and then from the group home came back, and
Mhm.
I've kind of experienced that. And I've also had friends, as you mentioned, the whole misconception of people are in it for the money. You- Believe it or not, I was adopted by my aunt, and my cousins will always tell me that. And I grew up with that. You were picked up off the streets.
Yeah.
You were adopted for the money. And when you hear things like that, it stayed with me for life. I
Yeah.
was maybe 5 years ago. My brother that was saying it, we now have a pretty good relationship. But I brought it up to him. I said, "Hey, man, you remember when because it really was hurting, and sometimes you got to just kind of let these things go. I can forgive, I won't forget, type stuff."
Yeah.
And I told him that. I said, "You used to say these things to me," and his response was, "It was just a joke." I said, "But for me, it wasn't funny. Like I didn't have my mom. I was
Right.
living with your mom. I already felt like, man, 2 years old, I was taken away, and you're telling me I was picked up. I was adopted for the money. And just understanding the lifestyle. Like it just also I started to grow resentment towards my mom, and had nothing to do with her, right? The one
Right.
that adopted me.
Yeah.
So I hear you on that, and it is not true. So many people just do it. My mom had four of her own, and she adopted three of us. As a single mom, 7 kids. She didn't do it for the money. She did it because she loved us, and
Right.
she didn't want us to just end up with another family, right?
Yeah.
She tried to at least keep us within the family. So I
Yes.
love that you do bring that up, because from time to time, again, do people do it? Maybe, but it's not the case,
Right,
all the time.
absolutely. Yeah, there's good and bad people everywhere, certainly. But for the
Mhm.
majority of my experience, the foster parents that we have, and those
Yeah,
that
I
work with
mean,
people with,
your brother.
right, yeah, right,
Yeah,
yeah, yeah, my
your
parents,
mom and
yeah,
dad wasn't it for the money. Yeah.
right, exactly, exactly.
Mhm. When we look at child welfare, mental health, and disability services, what's that one process that makes you think it's so outdated, it truly has to change? Is there anything out there that you're still like, why are we still working with this process?
Yeah, I think the biggest thing we need to change is the prevention. We need foster parents for sure. And if anybody wants to join us and be a foster parent, please do. But the biggest thing we really need to do is prevent children from coming into foster care to begin with.
Mhm.
And the money that flows, especially from the state and from Medicaid, goes to foster parents and supports them, and that's fine. But we don't do the same thing with our families. If a grandmother
Mm.
just steps up and says, "I will take care of my grandchildren," for some reason we expect her to like feed them out of love, right?
Mhm.
Why do we not give her the same financial benefits that we would give, a formal foster care situation? So the informal kinship care that happens all the time in our communities, right? Where an aunt steps in or a neighbor takes care of their neighbor's child or something. But we then say, okay, well, you're family, so that's it's your cousin, it's your
Mhm.
grandchild. we'll give you a little bit of money, but it's like, no, she deserves the same financial support, or he
Yeah.
deserves the same financial support.
I'll tell you what, and this may be completely off topic, but I wanted to bring it up because maybe you can give some clarification to this. Going back to my brother, he was adopted, and it just became so overbearing for my mom. He was just doing whatever he wanted to do, and really the last, thing that broke the camel's back was that he decided to slap her, right, in front of the cops. And my mom was like, "Listen, I can't. I got already all these kids. Like, I'm trying my best." So she had to kind of, per se, give him back to the state.
Yeah.
And they made her pay child support for all those years until he was 18 years old. And I was very surprised. I'm like, man, for someone that was trying her hardest and really cared, but now they're making her pay child support. I was just kind of in almost disbelief, but it's happening at all levels. You mentioned just because she was, aunt, that she wasn't getting all the support, but then on the other end as well, okay, well, we still going to have you support him, while biological mom and dad are out there and paying nothing.
Yeah.
So it is very different in that space of just what's kind of out there and things that need to be changed. And I'm happy that we have someone like yourself at the forefront that are seeing these things and truly just trying to figure out how do we make these changes, especially from the resources that you guys are providing. So I truly do love that. But if you could redesign foster care from scratch,
Oh, wow.
what's that one major thing you'd do differently?
Oh, that's a good question. So the system, we have a lot of systems that are unfortunately don't work really well in our country. And I would have our families and our children be our number one priority, right? We would have rates of example, our Medicaid rates. They're so low on a lot of things that then we have to compete to hire staff, and we can't pay them what they deserve for the work that they're doing, right? This is really, we can't just have anybody work with someone with a disability. We have to have people that are going to keep them safe and treat them well. And we need to be able to be competitive and retain them. And so one thing I would certainly do in the system is I would put the money, prioritize funds for that. I would certainly prioritize funds for prevention. And I know it's hard to prove something that doesn't happen. So that makes it hard when we put money into a family and prevent the child from coming into foster care. You can't prove that you prevented them, right? Because it didn't happen.
Yeah.
But we would see the numbers decrease overall. So I would shift a lot of our financial support to prevention. And I would certainly, for those that come into care or those that have a disability that need support, I would financially support those as well with appropriate and flexible funding so we can do what we need to do.
I love it, Renee, to just know that you're in this space. And what did your brother think about all this? I mean, him being in that space, right? Him being that foster child. Is he a part of the nonprofit as well? Is he just excited to see his sister doing this at this level?
Yeah, so he is doing something completely different, and he is not in this space, but he definitely is in my cheering section. Yeah, for sure.
Love
And
it.
I talk to him all the time about those difficult moments of, wanting to know who you are and where you came from and who your parents are. You were lucky that you stayed connected to your family, so you didn't have as many questions about that, right? But we got him when he was 6 weeks old, and then he didn't see, his biological family again until he was an adult. So, there's a lot of space where he didn't know, what's my mom's favorite food? What did we do for Christmas? What is it what are those traditions that my family have that I have no idea, what they are. Yeah.
Yeah. I want to pivot to you as a leader, and what you've been able to just kind of learn and accomplish. What's the biggest lesson in leadership you've learned the hard way? I mean, you're going from that therapist to a CEO. Is there anything that you felt that just still resonates with you? Like, man, I learned it, but I learned it pretty hard.
Yeah, one of the things is to separate yourself from ideas and strategies. So for instance, if you have an idea, it is just an idea. So don't get so caught up in it being your idea that you are unable to see when maybe it's not the best idea, right? So when I have ideas or I have suggestions, obviously you bring in voices, but you don't get so tied to that idea that you're unwilling to be, you're not flexible, or you can just say, that didn't work and let's try something new, right? And you don't have to take that personally. The idea didn't work. It's not that you didn't work. It's the idea that failed. And that's okay, right? And so if you can fail fast, like a lot of people say, you can get to a better solution. If you can just be like, okay, that didn't work.
Yeah. Yeah, no, I hear that all the time. Fail fast, fail forward, right?
Yes,
And
yes,
it is true.
yeah,
Failure truly at some point becomes success. It
yes.
is, and we see it all the time with some of the greats, is that you have to continue to fail and fail and fail, and you'll fail for years sometimes.
Hmm.
That one moment changes the whole trajectory.
Yes,
That one moment of success could change where you're at today. And that's what's so good about life at times, man. What's so good about God is that it- he'll show up
yeah,
when it's time,
yeah.
and being patient is
Hmm.
definitely key to it all as well. We know that nonprofits have this big challenge of funding.
Yes.
How do you approach that in a way that doesn't really feel like a never ending grind?
Okay, well, it does. But it's okay. That is just par for the course, right? So we rely a lot on Medicaid funding for the services that we provide, and then we just ask our communities to join us. So and a lot of our community does want to join us. It's just they don't know how, right? So it's a matter of I would love to help. What are some avenues? And so we provide them with lots of avenues. And we say, you can become a foster parent, or you can be a resource caregiver for someone with a disability, or you can go to our website and you can donate, or you can go to our Facebook page and just like a post. There's just so many different ways that you can join us in this mission. So
Yeah.
that's one of the things I try to do, is just make sure that we are just giving lots of people avenues to join us and welcome them. And we welcome all kinds of people with all different backgrounds, and we just know it takes a village, right? It takes a village.
It does, as you mentioned, just easy. Sometimes you're not able to donate, which is cool, but you can
Right.
still share the mission. You can still, as you mentioned, show support by a like or something like that.
Hmm.
Because some people may not even know this exists, or some
Right.
people may forget, right? It's like that whole out of sight, out of mind ordeal. Same way for your donors. If your donors donated last year, maybe they forgot this year.
Right.
We got to continue to get back to them, or we got to, as you mentioned, just hit that social media to let them know, and just sharing stories. And I'm pretty sure that's what you guys do already. But those stories of those foster kids, or those that are really gaining so much from the resources, when someone hears that in itself is just showing, oh, I see my money's going worth, to something that is beyond me. So I love it that you just mentioned it wasn't about just the funding; it's how you support at a small level as well.
Yes. Yes.
What's something that you wish more people understood about running a nonprofit or an organization like this?
It's such important work. It's meaningful work. Um, we have an amazing staff. They work tirelessly, and there's just no way, just for a lot of reasons, that we can compensate them at the level that they deserve, right? I mean, we see that with our teachers. We see that with a lot of people that choose to work with children. So, I wish people just, I hope, appreciate those that do this work, because it's really come from passion. It comes from an internal desire to make things better. Um, and we're here, and we will continue to be here, and we're going to continue to make the
Yep.
life better. And our work connects to your work, whether it's directly connected or not. If the children that we're serving have high rates of incarceration, that is going to impact you. If the children we serve that grow into adults end up homeless, that is going to impact you, right? Whether it's your taxes, whether it's how your community lives, whether it's when you're driving down the street and the people that you see, that are housing insecure. All of those things will eventually, right, wind its way back to impact
Mhm.
your life. So help us, and you'll also be helping yourself.
When you put it in that perspective, a lot of people don't see it that way, and I love that you
Yeah.
mentioned it in that space. I want you to think about fast forward 10 years. That's a lot of years, but let's 5 to 10 years.
Okay.
What did success actually look like for you? Like, what's different in the foster care and the mental health because of the work that you're actually doing now?
So hopefully there are less children that have to enter foster care. Hopefully our families are stronger, and they're getting the supports that they need in times of crisis. So small problems don't become big problems that then lead to parents not being able to parent their children. I hope we can have some impact on the alarming rates of substance abuse. We do provide, counseling, so that would have a ripple effect in itself if we, could impact the rates of substance abuse. We're going to need more counselors in our field, and it's not a field that counselors are going to at great rates. It's actually there's a reduction in counselors over time. So that's going to be an area that we're going to have to get really creative with when we have less counselors with increased needs. And then we have people with disabilities that have the supports that they need, that they're not on a waiting list waiting to get what they deserve. And that's unfortunate. In Virginia, you have like 12,000 people waiting on a list to get the appropriate services. And that shouldn't be.
Ms. Renee, I got a question because I really just want to know this answer because I was in the system. Are we seeing less people in the foster system than what it looked like 10 years ago, or are we actually seeing still an increase?
Still an increase.
Wow.
Unfortunately. Yeah. We're seeing intergenerational trauma, our families are so separated now, right? We tend to be, one family's here, another family maybe in another city or another state, and people are a little bit more isolated. And I think, so we got to bring our communities back together and support each other and value families and not judge them, but support them in their time of need.
I appreciate sharing that. I thought to myself, especially now as an adult and being a father, thinking that we're actually seeing some positive changes. But when you talk about just people repeating the cycle, I can definitely see and hear, see that. If I give you a magic wand to change any policy overnight for any of the resources you provide, what would that be and why?
Oh, wow. There's so many things I would change. I would definitely change that the fact that people with disabilities have to wait on waiting lists for the services that they need. We would just have to, just like some things we just have to provide, I think we just should provide the resources that people with a disability need to be their best selves and to have choice and to remain in their communities and not have to be institutionalized. That I would change in a heartbeat.
I love it. Let's talk about a little about innovation. How are nonprofits innovating nowadays with AI being really that sweet word everyone is talking about? Is that something that you guys as an organization are implementing or using for whether it's people to get resources or information a lot quicker, whether it's your donors, even your volunteers? Is there something in place for something like that?
Yeah, so we're exploring a lot of that right now. We are, I think, with a lot of people trying to get better understanding of what resources and tools are out there. So we're attending a lot of trainings. We are implementing some ideas with our donors. We are also implementing some of the AI with connecting with people who might be interested in our mission. So, those things where you talk about, I wish I had, a new refrigerator. Then the ad pops up magically, right?
Yeah.
So we're doing a little bit of passive listening kind of things, just so we can make sure that people that are interested in foster care or people that are interested in adoption or working with someone with a disability, they might see DePaul, right, pop up on their phone feed so they can get connected with us. We're also looking, though, how to make things more efficient for our workers. People don't go into this work a lot because they love paperwork. People go into this field because they want to help people. They want to connect with people, spend time with those that they're serving. So anything that we can use AI that is, keeps confidentiality and, HIPAA compliant and all of that, that can help our staff do their job more efficiently, especially when it comes to paperwork. So we're really looking into that, and as well as staying connected with our donor base and using AI to help us with that.
I love it. And if you had an AI expert or let's say AI agent help you when it comes to like client to community, would that be something that you're actually interested in?
Yeah, absolutely. We would love to have some technology. It's actually a training that we're going to provide in the fall. And so we're trying to find an AI component for a training for our staff. So someone who could do the AI piece and talk about that specifically in our work, because we see a lot of like general AI training, but if someone can bring that technology and that knowledge base and apply it to the work that we do on a daily basis and share that with our staff, that would be fantastic.
I love it. I love that. There's not a lot of leaders are at the forefront of it all. There's so many nonprofit leaders that is like, well, my staff uses it, the chat GPT because everyone's kind of using it, but they're still afraid. And I definitely see so much value and easy access when it comes to just having maybe that 24/7 live bot, because, those that are in the foster care system, those that are going through mental health, disabilities, they're up at any time. And how great would it be to actually go onto a website, have a conversation? It seems like very, like a person, and give you accurate, correct information. So
Yeah.
I love that you're kind of in that space. And we're about to get here to the end, to the fun part of the blind question. But for people listening who are inspired by what you are actually doing, how can they get involved with DePaul Community Resources?
Yeah, so if you live in Virginia, you could obviously become a foster parent or a resource parent with us. But even if you don't live in Virginia, I encourage you to go to our website, DePaulCR.org. You can check out how you can donate. You can also find us on Facebook, DePaul Community Resources, and on Instagram. So and share our information, interact with us. If you have questions, just reach out. We'd love to talk to you. So you can get involved in a lot of different ways, and just, you can go to our website and we've got all kinds of information there.
All right. This is the fun part. I always
Okay.
love these blind questions because the person I'm asking doesn't even know, and they're like, okay, hurry up. Yesterday I was actually talking to a leader, and she started the conversation, was like, so what's the blind question? I'm like, wait a minute, I got to get to you at the end. So you don't know what's coming, but it's always a fun one, right? If you had to trade places with anyone for a day, living or dead, who would it be and why?
Oh, okay. That is a
That's
good
a good
one.
one. That is a good one.
So this is tough. I think I would trade places with Barack so I could hang out with Michelle for the day. Yeah, assuming that
I
they're
love
together
it.
for whatever moment that is. I think
Yeah.
I would love to
Good
spend the
pick.
day with
Good
her.
pick.
Yeah,
Yeah.
and
I mean,
because
they're both phenomenal.
I know, I was like, do I trade places with her? But then that seems kind of, that doesn't
Yeah.
seem very nice. So I'm going to trade places with him, spend the day with her, because she's a phenomenal leader,
She is.
and she's just done so much, and she cares so much about children, and I think we'd have
Yeah.
fun.
I agree. I can see the vibes. I can see both your vibes meshing quite well, for sure.
Yeah.
So I give you the opportunity to ask now the next leader that we interview a blind question. So you ask the blind question here, we'll write it down, and we'll make sure that one of our other leaders that we interview here on the podcast also get that same question. So what is your question to them?
My question is going to be, what is the biggest misconception about your profession?
Okay. I love it.
Yeah.
I love it. Guys, if you're still watching with us, Miss Renee Brown, you guys can go to DePaulCR.org. Make sure that you guys check out what they're doing. If you guys love the mission, even if you guys cannot donate, please, as we mentioned, share, like, comment, send it to somebody that may need this information today. And thank you so much, Renee, for just being a leader in this space. And, it definitely touches my heart because I have been adopted. I understand the foster care system, just not as much as you do, clearly, because I'm learning a lot as we have this call. But I want to say thank you for the work that you do. And I know that it's never going to go unnoticed, and you're changing lives, even if people don't come and tell you that you are changing lives. And I'm so happy that we got to share this story and give you the platform so that others can see that no matter what the background looks like, no matter who you are, no matter what the upbringing is, there's still so many resources to really, I would say, level you up in this life. Okay. You're not in it alone. So Ms. Renee, thank you so much. For those that are watching, Ephraim, we'll catch you guys on the next episode.
Thank you.
Bye.